After failing to reach an agreement with Anthem Blue Cross Blue Shield by the March 31st deadline, MU Healthcare says it's open to further discussions. However, the dispute continues to impact patients across mid-Missouri as the two parties have failed to find common ground over proposed price increases. Our ABC 17's Mitchell Kaminsky joins us live outside of University Hospital tonight after speaking with representatives from MU Healthcare and Anthem. Mitchell, what's the status of those negotiations?
Megan, despite Anthem now being outed at work, MU Healthcare says it's open to further discussions with the provider over Commercial and Affordable Care Act insurance. However, Anthem told me in a statement today that it wishes MU Healthcare would spend more energy getting to the negotiation table as they have providing what they're calling misleading information.
Negotiations are still happening right now. We're looking to come to the table and have some meaningful conversations with Anthem.
MU Healthcare is taking issue with Anthem's public claims that it drew a hard line demanding a 39% increase over the next 3 years. The provider says it began negotiations with Anthem asking for an 11 to 13% increase each year over the next 3 years, but claims it made efforts to adjust the increase versus Anthem, who only offered a 2% increase.
We've come down considerably and made considerable compromises in what we've put across the table. The challenging part for us is that Anthem is offering us 1 to 2% increases in rates every year, annually. That doesn't cover our inflationary costs of supplies, labor, technology, pharmaceuticals.
Anthem disputed the claim in an email to ABC 17 News, writing, quote, "The numbers MU Healthcare has shared are not accurate. Anthem proposed rate increases that exceed the consumer price index for each year of a 3-year agreement, offers that are consistent with what other Missouri health systems have accepted," end quote. Another challenge for MU Healthcare is increasing uncertainty among patients.
We're certainly seeing uncertainty. Patients are unsure of where they can get care, if they can still get care. So there's been adjustments in our schedules, but we are definitely still busy.
In response, MU Healthcare has created a hub for patients with insurance questions, such as continued care paperwork and what out-of-pocket costs might look like. However, Anthem claims some of its members have still been denied, telling ABC 17 News it's aware of instances where Anthem members with approved continuity of care have been turned away by MU Healthcare. As the dispute drags on, other mid-Missouri hospitals have since reported an influx of calls about Anthem insurance. SSM Health Medical Group and the Jefferson City Medical Group say they've received an increase in calls and appointment requests from Anthem members. Meanwhile, Boone Health says it's in the process of expanding as the demand for health care continues to rise.
Right now, our relationships with our insurance companies are very, very strong, and we don't see that changing in the foreseeable future.
MU Healthcare tells me that recent tariffs have only added to inflationary costs and that they're already seeing an increase of expenses from about 6 to 8% each year. Because of this, they say that Anthem's alleged 2% proposal was not going to be enough for them to cover expenses while still providing quality care. Reporting live in Columbia, Mitch Kaminsky, ABC 17 News.
Mitchell, thank you. Now you can read more about these negotiations and resources to contact for questions about your insurance on our website, abc17news.com.